Hello, my name is Kayla.
And my name is Mary. We will be giving you all a bit of information about lung cancer.
Lung cancer cases in 2021 were at about 235,760 new cases, where 119,100 were in men and 116,660 were in women. Deaths amounted to 131,880, where 69,410 were men and 62,470 were women.
Symptoms for lung cancer are the following: coughing that gets worse or doesn't go away, chest pain, shortness of breath, wheezing, coughing up blood, feeling very tired all the time, and weight loss with no known cause.
When people go to the doctor to get diagnosed, it is typically done through screenings. Doctors will have patients take chest x rays, a CT scan to see if there are tumors, MRI scan to see if it has spread, and a PET scan to see if it has traveled into other organs like the liver or if it has spread to the adrenal glands.
Treatment for lung cancer depends on the stage of the cancer, but also depends on the type of lung cancer a person has. There are two main groups of cancers we should discuss first. One group is non-small cell lung cancer, and the other is small cell lung cancer.
Non-small cell lung cancer and small cell lung cancer are both diagnosed with most of the same tests and have essentially the same risk factors for development, the most common one being smoking.
There are some key differences that affect treatment options. The first one is that non-small cell lung cancer is more common than small cell lung cancer. Non-small cell lung cancer accounts for 9 out of 10 of the diagnosis, and small cell lung cancer represents 20% of lung cancers. The second key difference is that small cell lung cancer spreads at a faster rate than non-small cell lung cancer, where 70% of people with small cell lung cancer have a cancer that has already spread by the time they are diagnosed. Now, non-small cell lung cancer is still pretty dangerous, and one reason for this is that it develops slowly and often causes few or no symptoms until it has advanced. So people are still at risk of being diagnosed when the cancer is at a later stage.
This is why it is super important to get diagnosed as soon as possible to prevent a more difficult treatment and have a higher survival rate.
Keep in mind that treatment depends on the stage of the cancer, but also other factors such as a person's overall health and lung function, as well as certain traits of the cancer itself. In many cancers, more than one treatment is used.
Both cancers can be treated with surgery, chemotherapy, and immunotherapy.
Small cell lung cancer can also be treated with palliative care, which aims to relieve symptoms and improve a person's quality of life. Non-small cell lung cancer can be treated with radiofrequency ablation and targeted drug therapy. The survival rate is calculated looking at the relative 5-year rate. For non-small cell lung cancer, when the cancer is localized, a person has a 63% survival rate. When it is regional, it's 35%. When it is distant, 7%, and all stages combined is an average of 25%. For small cell lung cancer, when it is localized, it is 27%, regional 16%, distant 3%, and all stages combined 7%.
These percentages highlight why it is important to avoid the main causes of lung cancer, which are smoking tobacco, cigarettes, secondhand smoke, and exposure to asbestos or radon. You also want to make sure that you are aware of any history of lung cancer in your family.
So, if you have never smoked, don't start now. And also try to avoid secondhand smoke.
Test your home for radon and avoid carcinogens at work. A list of possible carcinogens can be found on the cancer.org website.
And make sure you are eating a diet full of fruits and vegetables and exercising every day.
Thank you for watching our presentation.